And we begin this morning with some hopeful news coming out of the CDC in the battle against COVID-19. New research shows that the U.S. could be through the worst of the pandemic by July, with new cases and deaths making a sharp decline. But that could be undermined by vaccine hesitancy and people foregoing masks and social distancing. And while the CDC calls variants a, quote, wild card, both Moderna and Pfizer say that their shots are proving effective against those that originated in the UK and South Africa. So the news comes as the Biden administration says that it will support suspending patents on vaccines in order to bolster production amid concerns about equitable access around the globe. Laura Podesta is in New York City with the latest details on this. Good morning, Laura.
Good morning, Anne-Marie. Yes, a lot of good news this morning, but the CDC says that cases will only continue to drop if people who choose not to be vaccinated continue to wear masks and socially distance. Otherwise, we could potentially see another surge and be further away from herd immunity.
The U.S. could soon see a dramatic drop in the number of COVID-19 cases, hospitalizations, and deaths, according to new projections from the CDC.
In good news, the models projected a sharp decline in cases by July 2021, and an even faster decline if more people get vaccinated sooner.
CDC Director Rochelle Walensky did offer a warning if unvaccinated people don't wear masks or socially distance.
Variants are a wild card that could reverse this progress we have made.
The Biden administration hopes 70% of the country will be at least partially vaccinated by July 4th. Health experts say the margins could be razor thin.
5 or 6% could be the difference between really having protection as a society versus still having a lot of active cases out there.
As the country reopens,
the more people get vaccinated, the more they feel safe to come in.
Some are working to overcome their nerves after a year inside.
Ask yourself what you used to love doing. Did you love going to the museum? Did you love a specific store at the mall? It'll also give you something to look forward to, even if there is a little bit of anxiety and stress.
For Margalie Blackman, it's a visit to the park with her family.
I was actually just telling my son today, I'm like, we're going to be out a lot more this summer than we were last summer, so get used to it.
For others, it may be a trip to the ballpark. In New York, vaccines are being offered to people attending Mets or Yankees games. Fans who get a shot will be given a free ticket to a future game.
Now, to combat the virus overseas, as you mentioned earlier, Anne-Marie, the Biden administration is going to be working with the World Trade Organization to waive intellectual property rules. That way, countries can begin manufacturing vaccines that are modeled after Pfizer, Moderna, AstraZeneca, and Johnson & Johnson.
That is a good idea, but here's the thing. Pharmaceutical companies spend an awful lot of money to research and develop these drugs, and I know some of them did get funding from governments to do this, but I'm wondering if there's any pushback from pharmaceutical companies regarding this sort of temporary IP waiver.
There absolutely is. The Washington Post is reporting that these drug manufacturers say this could really backfire. If you ramp up production worldwide, there could be competition for some of the essential ingredients that go into these vaccines. There could also be a backup in manufacturing, and worst case scenario, there could be counterfeit vaccines that are put out there. The Biden administration, though, has said they do not take this decision lightly. They've been meeting about it for weeks before coming to this determination that we really should be providing this intellectual guidance to other countries. Anne-Marie.
I want to ask you about something else, this idea of pharmacy deserts, basically areas of the country where, there isn't a pharmacy or a clinic that's very close by, rural areas, so it's difficult for people to get access to the vaccine. Is the government doing anything about that?
Yes, there are now pop-up clinics and there are mobile clinics that are going to provide vaccine access to some of these pharmacy desert or areas where a pharmacy is miles away. There are also several states that are giving transportation options to seniors or people that cannot drive themselves to a vaccine site. That's available in places like Pennsylvania, North and South Carolina, and Vermont, to name a few.
Good news. Laura, thank you so much.